Hi, Assalamu'alaikum warahmatullahi wabarakatuh and a very good day to all of you. We are from Group 2. We present you about plasma derivative. Our group members are Omar, Fahima, Natra Alia, Farhana, Najha and Chu Wei Kong. Plasma derivative is a product that contains concentrated fraction of plasma proteins that have been separated by using physicochemical or other fractionation process. It is made by fractionating the fresh frozen plasma or stored plasma. Plasma derivatives include coagulation factors, albumin, and also immune globulins.
Now, the indication of plasma derivatives used in patient therapy. Coagulation factor, the plasma derivative used to treat patient, for example, factor replacement therapy. This is the basic treatment used to stop or prevent bleeding in people with hemophilia A and B. Factor 8 is used to treat patient with hemophilia A that has the deficiency of factor 8, while factor 9 is hemophilia B patient. The injection into the bloodstream is the way to administer this factor. Next, antithrombin is used to treat antithrombin 3 deficiency patients that can cause thrombosis. The administration through intravenous route. Antithrombin 3 deficiency usually happen in neonates. Albumin, one of the plasma derivatives that used to treat hypovolemia and hypoalbuminemia. Hypovolemia means decreases volume of circulating blood in the body, and hypoalbuminemia is less albumin in the blood. This applies same type of administration, which is intravenous route.
Next is immune globulins. Immune globulins provide passive immunity to infectious disease. The protection will be of rapid onset but of short duration, 1 until 3 months. It may be administered by intravenous or intramuscular injection. Immune globulins have 5 parts. First is non-specific immune serum globulin. It is to prevent prophylaxis of hepatitis A, measles, and also used for immunoglobulin deficiency. Second is Rh immune globulin. It is used for prevention of sensitization to the Rhd antigen and also hemolytic disease of the newborn. Third is hepatitis B immune globulin. It is used to prevent infection in case of accidental contact with patient with acute hepatitis B within 1 week of last contact. Fourth is varicella zoster immune globulin. It is used for prevention of varicella zoster infection in exposed susceptible individuals who have a greater risk of complication from varicella. And the last one, the fifth, is tetanus immune globulin. It is used for transient protection against tetanus post-exposure to tetanus.
Next, I would like to talk about the effects and outcomes of some plasma derivatives in patient management. Firstly, I would like to talk about the effects of the infusion of the coagulation factors including factor 8 concentrates, factor 9 concentrates, and also antithrombin 3. In both cases, the factor 8 and factor 9 protein is nearly identical to the protein which is lacking in the blood of hemophiliacs. After an infusion of the concentrates, all the proteins needed for clotting are in place. A hemophiliac's blood becomes normal at least for a few hours. This allows the time for a clot to form at the site of the damaged blood vessel. Next, acquired antithrombin 3 deficiency is due to decreased production or increased consumption of the antithrombin 3. In either case, treatment of the underlying disease and replacement of antithrombin 3 using antithrombin 3 concentrates is the most common approach used. Antithrombin 3 is expected to rise in its level after it is being infused into the patient to compensate its low level. After that, albumin is the predominant product of hepatic protein synthesis and one of the most abundant plasma proteins. Albumin as a plasma derivative also acts as a plasma expander. The administration of a volume of 25% albumin solution causes 3.5 times the administered volume to be drawn into the circulation within 15 minutes. Besides, it also can draw interstitial fluid into a circulation. This can increase the circulation volume. Lastly, I would like to explain about immunoglobulin. Immunoglobulin is used in patients with a variety of conditions, including the reduced level of IgG and also lacking in quality, which is unable to respond to antigens as they normally should. Immunoglobulin infusion increases the quantity and also quality of IgG they possess. After being injected with immunoglobulin, the level of IgG should increase to a normal level with good quality.
Next, we move to the laboratory test in selecting and monitoring of blood plasma. For coagulation factors, factor 8, when the lab test is been done, if it decrease in hemophilia A, it will be mild hemophilia A, 5% to 50%, moderate hemophilia A, 1% to 5%, severe hemophilia A, less than 1%. But in normal in hemophilia B, 55 until 200%. Other than that, factor 9, it will decrease in hemophilia B. Mild hemophilia B, 5% to 15%. Moderate hemophilia B, 1% to 5%. Severe hemophilia B, less than 1%. But normal in hemophilia A, 65 until 140%. Other than that, anti-globulin ICC decrease antithrombin activity will indicate as type 1 antithrombin deficiency, less antithrombin in protein regulation. Reduced antithrombin activity and normal levels of antithrombin antigens will indicate type 2 antithrombin deficiency, sufficient antithrombin protein but not functioning, risk of developing an inappropriate blood clot. For normal antithrombin level will not do because it is normal. Albumin, the lab test will give if more or equal to 12 months, it must supposed to be 3.5 until 5 gram per dl. For immunoglobulins, rhesus immunoglobulins, for normal, less or equal to 1.5 ml of fetal RBCs in normal adults. And lastly, hepatitis B immunoglobulin. A positive result indicates acute, chronic or past resolved hepatitis. Okay, that's our presentation about the plasma derivatives. This here the reference, you can do some references. Thank you.